if the inclusion-exclusion criteria are not clear, meaning you have very generalized terminology, then that obviously should make you very nervous that you're not really getting the full story. Furthermore, it should be something that's reasonable, meaning if everybody is supposed to be healthy, except for the disease state being studied, in our field, comorbidities are common, and comorbidities increase the risk for adverse events. And you want to understand more of a general patient population, not a highly specific, highly selected patient population that might not have adverse events just because of their selection bias. So you want to be sure there isn't selection bias in the context of what you're trying to show. The key points of actually opening up a manuscript or a study in a journal that you're going to look at is obviously what the hypothesis is, and to understand the hypothesis, to understand the power, meaning is it a 90% power, and to understand what the primary outcome is. Once you understand that, the methodology section tells you what patients were used or not used, what the exclusion criteria are, what other drugs are the patients on. Could these other drugs inform you about experiences with the new study drug and what happens as an interaction with the other drugs that they're on? In rheumatoid arthritis and in multiple areas in our field, it's not uncommon to have all the patients on some therapy as background, and you add on top this new treatment to study its effects, and you have to be very careful to determine the outcome as a result. The other thing is you want to know a consort diagram. You want to know a patient distribution throughout the trial, and you'd like to be able to see that early to understand whether or not randomization was correct, whether it was balanced or imbalanced. Then you want to look at patient demographics, the fundamentals of the patient, the age, the bone, the BMI, how much they weigh, what their number of years of disease is, what other drugs they're on. And imbalances in those may make a big difference. And then you look at, in fact, how many patients dropped out and how missingness, how these patients who dropped out were actually interpreted in their evidence. That's called a sensitivity analysis. If they're not, then I'm not entirely sure I even read the paper if that's not explained to me up front about how that's handled. And then there's the results.